What is public health? If you were to ask someone what public health was, it's very likely that they would tell you going to your yearly physical or seeing your GP if there's something wrong with you, when in reality they're thinking of clinical health, which would be treating a disease or injury after it's already occurred. Public health looks to prevent any injuries or disease before they even happen, so you shouldn't have to actually go to see your GP in the first place. One of the biggest breakthroughs in the 20th century in terms of public health development was the increase of motor safety. To put it into perspective, since roughly the 1920s, the miles driven in a vehicle have increased tenfold. Yet the deaths per 100 million miles driven in a vehicle have gone from 18 to 1.7, thanks to the efforts of public health. Components such as seat belts, headrests, and shatterproof windshields are necessary in vehicles because of public health. Thanks to the field of public health, you're able to drive around throughout the day with a moderate level of safety, especially compared to that of the 1920s. Another great example of public health would be free school lunches. Some schools across the US today offer lunches for free to everybody, not just those who fit within a certain tax bracket and are eligible for said free lunches. Those who work within the field of public health were part of the major push towards these free school lunches. Another example of public health would be that of health inspectors. Thanks to the efforts of public health, you know that you can go to a restaurant, eat the food there, and not be sick the next day. Another component of public health is that of public transportation. Public transportation is an example of public health because it can allow those who do not have a car to get around far distances safely or access that which, without a car, they would not be able to, like a medical appointment. Even law and policymakers are considered a section of public health. This is because policymakers have the ability to implement upstream strategies, that of which public health is mainly focused on. They look to solve issues before they even happen. A good way to do that is to implement laws and policies that prevent that issue from happening in the first place. Hopefully, this was a good breakdown of public health and the many facets of the field.